You're listening to Lone Star Internet Radio. That was Sam Riggs and the Night People. Like I said, we're going to have two special guests this morning, and they're sitting right here with me. It's none other than Joy and Dr. Arroyo. Welcome to Lone Star Internet Radio.
Thank you.
Thank you.
I said it right?
Mm-hmm. Yeah,
okay,
you said it perfect.
Yes, said it perfect. If you didn't know who these folks are, you need to go to www.ihealthconsultants.com because Dr. Arroyo does some pretty special things, and there are also one unique thing in the Woodlands. And also, where else can you go to do this kind of the special deal you do?
Well, thanks for having us here.
You're welcome.
Dick. We have two offices. One of them is in Houston, north from they're right off 45, both of them, but one of them is north from 610. The other one is right in the heart of the Woodlands, right behind Herman Hospital. And since everybody knows Herman, you know where we are.
But you, the reason I really wanted you to come in because you do something pretty unique, and it's called Corneal Molding.
Correct.
Okay, yes, and it's when I was hearing about it, it was one of those kind of sci-fi kind of things. You put in a contact, or similar to a contact, and you go to sleep, and you wake up, and do you take it out, or is it dissolved?
No, you take it out.
Take it out. Okay.
This is actually it lasts very long, but it's sort of a corneal device that looks like a very special contact lens in the sense that it has the shape of a contact lens, but obviously it does much more than a contact lens. And you put these devices before you go to bed, and then you remove them in the morning. And what these corneal devices do is simply to gently reshape the corneal curvature by changing the corneal curvature. What you're doing is actually changing the refractive status of the eye. I mean, if you think about LASIK, what LASIK does is to sort of pulverize, burn, destroy, get rid of some of the corneal tissue. It does so in a sense that it changes the corneal curvature, but it changes the corneal curvature by removing the tissue. What we're doing with corneal molding is not removing it, but actually molding it or reshaping it. So the tissue is still there. The cornea is still a virgin cornea, hasn't not been surgically affected, but by changing the shape of the cornea, we're actually correcting the vision, so by the time you remove those molds in the morning, you're able to see clear without glasses or contacts.
Okay, so now this is when I first heard about it. It reminded me of Invisalign, which is the non-braces of braces. Now with this procedure, is it just a temporary or is it a goal? Like you go, okay, we're going to try to get you from here to here in 1 year. So your prescription, your corneal molding is going to be different every 2 weeks, or is it just going to be it's just another technique of?
Yeah, that's a great question, Dick, and that's actually a question we get all the time. Well, you can think of these as a way to recharge your batteries while you sleep. So during the day, you don't have to wear anything. Those molds last a very long time. They can last 2, 3, 4 years. But you do wear them every night. Many patients, at least 50% of the patients, we have about 450, 500 patients now. And about half of them will wear them just 3 times a week for maintenance, 4 times a week, every other night, something like that. So sometimes you don't need to wear them every night, but you do have to wear them at night to be able to see. As a matter of fact, you were talking about Invisalign, and there's some doctors out there that some orthocare, corneal molding practitioners that have actually made that comparison and call them braces for the eyes. I'm not sure I like that because braces sounds like something painful for the eye, right? There's no metal here, so there's really no pain. So, but yeah, it's something that you have to continue to wear to use. The future will hold, hopefully the near future will make changes or updates to this way of doing things right now. We can talk about that later.
Yeah, okay. Well, let me get to know you guys a little bit better. Like I said, y'all are in the Woodlands. How long have y'all been in the Woodlands?
We've been in the Woodlands since January 2011, 3 years,
cool.
And time runs really fast.
And what do you guys think of the Woodlands?
Well, we love it there. The office is just really meeting a lot of needs in the community. We're seeing a lot of children. We're seeing a lot of, even their parents come in. They're starting to get to know Dr. Arroyo and just realize how innovative and how compassionate he is with vision care and eye care and just a host of other issues sometimes that patients have that are contributing to their vision problems. So he really looks at the whole picture, and people are starting to realize that and appreciate that in Dr. Arroyo. So the reputation is really growing in the community, and we're enjoying meeting a lot of people from the area.
Yeah, that's great, because I know the Woodlands and especially Montgomery County is a growing place, and
Sure.
especially for something like a new technique like this, it's a great place to, I guess, now I wouldn't say you're testing it out, but it's a great place to start. And it's also nice to know that you're compassionate, because I know when someone's on the new frontier of technology, you got to have somebody who you can feel comfortable with, because
Exactly.
you always, some people always think the bedside manner of a doctor is always cold, that thing.
Yeah.
So that's
there.
good. So other than corneal molding, you're just a standard.
Well, we do comprehensive eye care. From anything short of surgery, we do it at the office. I mean, we have a lot of patients, a large glaucoma practice. And obviously, we do eye exams for glasses and contacts, and people come with dry eye infections, whatnot. We don't do any surgery in the office, but only just minor procedures, very minor things like removing a foreign body or implanting, pontal plaques for dry, or very minor things. But what we focus on is on I like to call it integrative eye care or eye health solutions. And integrated means using what is best for the patients, whether it is allopathic or natural. I am a big believer or passionate eye doctor that believes in natural methods. You can call them holistic. And that's because I think we can tackle or face problems much better when we understand the cause of it. So what we focus on is in understanding the cause of the pathology, and then we target those causes to make the problem disappear. So we use a lot of natural protocols with great success. We probably talk about something I am very passionate about, and I don't want to get too long with it, but there's a lot of folks out there with macular degeneration. And they've been offered very, very little help until recently, because of the fact that, it is incurable. And then when you have some options, that means that your eyes are already pretty bad. You have two different forms of macular degeneration, wet and dry, and the wet form is the only one that has any significant treatment in conventional medicine. And by the time you have a wet macular degeneration, your eyes are pretty much destroyed. We can actually help promote the health of the macula in a very spectacular way before it turns that way, and even when it turns that way. And patients are getting great results, and we're doing that through natural protocols. So that's very interesting, something we're very excited about.
Okay, do you mind if we go back to the music for a bit, and when we come back, we'll extend on everything, because I'm very interested in the corneal molding and also more about you and where you come from. So if you would sit back and relax right now, we're going to play some great music on Lone Star in the mornings, and we'll be back with Dr. Arroyo and Joy of Eye Health Consultants. Right? That's
perfect.
Good.
Thank you.
All right, here's some Cody Canada Departed. Prayer for the Lonely. You're listening to Lone Star Internet Radio. We'll be back.
Lord, pick me up, dust me off.
Do you ever wonder what's going on in the business community? Are you looking for ways to get plugged in? Cassandra Roshan here, Director of Membership Development with the Greater Conroe, Lake Conroe Area Chamber of Commerce, and I would like to invite you to tune in to Chamber Chat. Tune in the first Tuesday of every month at 11 a.m. so you will be in the know for all Chamber happenings for the month. Each month, the Chamber offers 2 free lunch and learn sessions, a networking breakfast, business after hours, membership luncheon, as well as many other special events throughout the year. I will give you a rundown of all programs and events for the month, as well as interview our speakers and hosts of these events. So grab a cup of coffee and tune in to Chamber Chat the first Tuesday of every month at 11 a.m. Chat with you then.
Hi, this is Judy Deo, Executive Director of Tamagua Healthcare Ministries. Tamagua is a Christian ministry that, by the grace of God and in response to the love of Jesus, provides quality health care, offers hope, and restores dignity to uninsured, low-income families and individuals in Northwest Harris County and Montgomery and Waller counties. As a primary care safety net clinic, we provide for the physical, mental, emotional, and spiritual needs of our patients, and we do it only with the financial support of the community in which we serve. Tamagua receives no government funding. To find out how you can help or to make a donation, visit our website at www.tamagua.org. Tamagua is spelled Tomagwa. Thank you, and God bless you.
Have you ever wandered around a parking lot trying to look like you actually know where you parked? Then you'll love the Mark and Cindy Show. If buying toilet paper with aloe vera is the most exciting thing you're going to do today, then you'll love the Mark and Cindy Show. Even if you haven't tweeted, you'll still love the Mark and Cindy Show.
How about twerking?
Ew, that was one step over the line, Mark.
Well, you said toilet paper.
Look, we want listeners to tune in to the Mark and Cindy Show at 10 o'clock every weekday morning here on Lone Star Internet Radio.
The Mark and Cindy Show, it's like visiting with your best friends for coffee, except we will never stiff you with a check.
And one of us always knows what she's talking about.
Well, okay, but it's still called the Mark and Cindy Show. You know that.
We'll see. The Mark and Cindy Show. Tune in to Lone Star Radio every weekday morning at 10 o'clock.
That was Big Joe Walker Friday night in Texas. You're listening to Mornings with Lone Star. It's another gloomy downtown Conroe day, but I like it. It looks good. 61 degrees outside. I'm sitting here with Dr. Arroyo and Joy of the Eye Health Consultants. There you go. Got it. And we're talking about general eye health care and also corneal molding, which is a new technique people are doing for eye correctiveness, correct? Is that what you call eye correctiveness, or
vision correction?
Vision correction. Okay, because you gotta be really specific when you choose talk about this kind of stuff, because a lot of people, especially anything that has to do with medical, I always feel like I'm always misrepresenting things. And then every time I talk about, like, you don't know what you're talking about, I was like, yeah, pretty much, and I wish I did, but
I think you're doing very well so far.
I'm
more worried about me.
Because really, it is important, because a lot of people relay information a lot, and if it's misinformation, then someone's going to get in trouble. But no, thank you so much for being in the studio. When I first heard about what you do with the corneal molding, that was very interesting. Like I said earlier on the program, it's like sci-fi-ish, kind of like this is different, and I definitely have a lot of questions about that. But you also do a lot more other stuff, especially with eye care and eye exams, because you do actually. Well, when we're doing a break, it sounds like you're the person to go to, like you're like the house. The house doctor, from the show, because you figure out what's going on with my eyes.
Well, I'm not sure I can be the house, but this sounds like a pretty genius guy. I've considered myself pretty average, but we do think out of the box, and we do eye care. We're very ambitious in the sense of our standards and what we do to help people to create customized eye health solutions. And what that means is that I go out there to the literature and I look everywhere, not just on conventional medicine, but unconventional and holistic and natural. And I bring it all, I integrate it, and we put together protocols that integrate allopathic medicine and natural medicine and create solutions that work for the patient. We don't care where these solutions are coming from, as long as they are safe and they actually help the patient. That's what we do. We have a passion for holistic and natural medicine, or natural eye care.
Okay, because that's when it comes to the eye is a pretty amazing organ, because it is an organ. It's considered an organ, correct?
Absolutely.
And I know everyone that I speak to, especially I had a friend in optometry school, and she was telling me they had to put needles in their eyes, and I was like, there's no way I could do that. But they had to do it she said it was one of the most nerve-wracking things, because they had to choose a partner, but they didn't get to choose. They had to draw. So, there's some people in your class who's like, I don't want this guy or woman with the needle near my eye. But no, that's, like I said, the eye is such an interesting thing. And there's so many different things developing every day about the eye. We're learning more and more about our body, which is really cool. A lot of people are like, oh, let's go to space or let's go under the sea. I'm like, well, what about our body? We're still dying here. Let's figure this out first. That's my joke with people who want to go out to space. Because we only live. Well, actually, we're doing pretty all right. We're all right. We're like our average age is like 75 or 76 now in the United States, which isn't too bad. It's a lot better than 100 years ago. But that's getting away from the point. But over at Eye Health Consultants, you do a lot of really neat exam. Not when I say neat, I mean interesting exams, and you offer a lot of services, not just the typical. Oh, I need to get my glasses checked or my eyes checked, and then you also do the corneal molding. Which, if you don't mind, if I ask a couple questions about that, if you don't mind.
Oh, absolutely.
One of the coolest things that I like about this, because it's basically when you present it to somebody, it's like an alternative. And what are the benefits of the alternative? Because there's always options, there's always pros and cons. And reading yours, like if it's right for you, one thing that pops out is the younger age patients, because it's a better option, which makes sense to me. And then when you have athletes. Now, when it comes to athletes, how is the corneal molding more, I guess, efficient, or what are the pros and cons for an athlete to wear that opposed to contacts?
Well, first of all, corneal molding is an approved FDA procedure, and you can do it in patients as young as 8-9 years old, and as old as 70, as long as they don't have any eye disease, cataracts or retinal problems or whatnot. But getting to your point, what is the difference between having nothing in your eyes and be able to see, and having to wear a contact lens to be able to see? Well, quite a different story, right? I mean, the contact lens, they're very modern, effective contact lens nowadays, but there's still something in the eye. They move, something got in the eye, a little bit of dust, debris. How about swimmers that are swimming and they can wear contacts? How about I don't know, karate or boxing, or situations where you have those movements that you don't want to have something in the eye. With corneal molding, your naked eyes are seeing, so that's pretty cool in the sense that you don't have to wear anything to be able to see. Now I don't want to we'll talk about that, but this is a huge thing for kids, and that's the main point that we're going to get to, is why this is so cool, so important, so relevant, so magnificent option for kids.
Okay, let's expand on that. Tell me more about the option for the kids. What makes it so much, like it's such a bigger leap than what we've been able to do in the past? Correct.
Well, here's the story. 100 years ago, less than 10% of the population were myopic. Myopia means nearsightedness, and nearsightedness should be called short distance vision, right? Because when you're nearsighted, you're seeing blurry anything from 1 meter away, right? So 100 years ago, your average 1 out of 10 people would be somewhat myopic or nearsighted, meaning they wouldn't be able to see far away. Well, right now in the United States is reaching 40%. So the proportions of myopic or nearsighted kids are staggering. There's so many people, so many kids that are nearsighted. But the thing that makes it worse is the fact that myopia gets worse. So during your developing years, let's say you start being myopic and say, Mom, I can see far away, I can see the board. So here it is, son, we're going to take you to the eye doctor, and they're going to put you on glasses. Well, that's not the end of the story, because the problem is going to be that 1 year later, when they go back to the doctor, they're going to say, well, I don't think I can see with these glasses anymore. So the doctors will say, well, don't worry, your prescription went up, so we're going to give you stronger glasses. And then you come back in a year and say, well, my prescription got even worse now. Well, don't worry, we can put your contacts, so those glasses are not so ugly, they're thick lenses. Well, that's like going to the heart doctor, and you go to the heart doctor and say, well, I have a pain, doc, here in my heart, what can you do for it? Well, don't worry, I'm going to give you some medication for it. Come back in a year. So you come back in a year and they say, well, I have bad news and good news. The bad news is that your heart condition got worse, but don't worry, I have this stronger medication for you. Come back in a year. And then you come back in a year and you say, well, doc, I guess I'm feeling okay. What do you think? Well, I have bad news and good news. The bad news is that your heart condition is now even worse. But don't worry, I have this super strong, good medication that you'll be okay. Well, that's madness, don't you think? If we're telling our kids, well, we can't do anything for your myopia progression, we're just going to give you bigger and bigger lenses or thicker and thicker glasses. I don't think that's the best we can do. And what we should be doing actually is to stop that progression. So you see a kid that is nearsighted, we should stop that process from getting worse, don't you think? I think, if we want to protect the future of our kids, they shouldn't be getting worse. What we're doing it with glasses and contacts, we're just giving them a crutch. Just kind of, we'll hide the problem, the symptoms, just be okay. You'll be okay. You wear these glasses. Well, I want to stop that progression. What corneal molding is the answer, is the gold standard. Corneal molding, orthokeratology, ortho-K, same thing. But with corneal molding, what we're doing is stopping, putting to a halt that progression of myopia in these kids that are simply getting worse by the month, by the year. So by the time that they are 21, they won't be blinder.
Well, that does make sense. I'm surprised no one really started that up a long time ago. But so your solution is the corneal molding, or is there another procedure you're looking at? Or
so corneal molding, when you put these patients on corneal molding, when you put these kids on the program on corneal molding, they not only can see clear during waking hours without anything in their eyes, but what we're also doing is preventing their myopia from getting worse. We are stopping that myopia problem from getting worse. So, like I said, if you start on the corneal molding program, I can tell you're going to see clear. But also what's going to happen is that your myopia is not going to get worse. It's like, again, going to the heart doctor and say, well, I'm going to put you on a treatment that your heart will stay okay, will be okay, it won't get worse. So we'll make sure that your your myopia won't get worse. That's the bottom line, and that's the huge thing for kids. Nothing else can do that. There are 4 or 5 randomized studies to prove that corneal molding is the answer and the gold standard for these kind of cases where myopia is getting worse, and all kids that have myopia get worse, period.
That's an unfortunate scenario, and I'm glad we're working on it. That's cool. So if somebody's listening in and they want to know more information, the best way to reach you guys is by visiting you on the internet, would you say?
Well, they could go to eyehealthconsultant.com or correctyourvisionwhileyouSleep.com. And they have a ton of information there. We provide free consultations to evaluate candidacy and to explain in depth the procedure and the protocols that we use. And we enjoy doing so.
And your office in the Woodlands is located at 111 Medical Plaza Drive, Suite 110 in the Woodlands, Texas, right?
That is correct. It's actually 4 1s.
111. Sorry, yeah.
11.
11.
And then if I'm reading this correctly, the phone number will be 281-419-3355.
That is correct.
That's to call you. And you said you're right by Herman? Is that what it was?
Right behind Herman.
Right
Hospital,
behind Herman. Okay.
Right on Medical Plaza Drive with Pikenoff.
And then, so if you guys have any questions, that's where they're located. eyehealthconsultants.com has a lot more information on it. It's actually pretty neat to learn more about how to take care of your eye and what else Dr. Arroyo can offer you guys. And I want to say a special thanks for y'all to come in and join us on Mornings with Lone Star. I hope hopefully to see you guys again. If there's anything else you would like to let the audience know, now's your chance. What would you like to let them know, Joy? Anything?
Well, I can just say that I met Dr. Arroyo 3 years ago after he moved to the Woodlands. My daughter was 11 at the time. She had been in glasses since first grade. She was at the end of her 6th grade year. She was asking me to move into contacts. And between first grade and 6th grade, she had 4 prescription changes. So we were getting thicker glasses. And I knew she was self-conscious about wearing glasses and as going into junior high. So I started looking for options for her. I read about Dr. Arroyo, and I took her in for a consultation and met him. He told me, she's a great candidate for it. And so my husband and I decided to move forward, especially after he explained the fact that I could help prevent her from getting worse, stop her vision right where it is, that prescription, because I had already seen 4 prescription changes in such a short amount of time. I could imagine through her teen years and moving into adulthood how bad her vision could possibly be. So that was the main thing that triggered it for me. I said, okay, let's do this. And so she's been using corneal molds starting at 11. She's 14 now. Her prescription has not changed during that time. She has had a great experience with it. Especially in the summer when she's swimming and playing in the pool and just being outside and with
I didn't
sweat.
think about that.
Yeah, and it just frees her up, and it really did change her life. I can honestly say it was a life changer for her.
That's pretty cool. I did not even think, because you can really wear them, or not wear, I guess.
Yeah, you're just free of everything. You're not dealing with contacts or glasses when you're playing, swimming, doing sports. Athletes dealing with sweat. They're out on the field. They're on the court. It's just the best solution for them.
And you can find more at ihealthconsultants.com. Again, thank you, Dr. Arroyo, for coming in.
Thank you for having us.
Enjoy. And hopefully I'll see y'all soon. We're going to get back to the music. The Mark and Cindy show starts at 10 o'clock. They're going to be talking to all things going on this last weekend about the Go Texan Parade. Also, they did a little chili cook-off, so I'm interested to hear the results of I think there were judges. So that's going to be interesting. But music coming up is music chosen by you and me. Here's some Daryl Dodd. Something ain't always better than nothing. You're listening to Lone Star in the Mornings.
Hey everyone, this is Tina, your host from Retro Saturdays. I wanted to invite you to visit the Lone Star Studios here in downtown Conroe, Texas. We're all volunteers here, and we need your help in serving the Montgomery County area. Radio media is a fun field to be in. Lone Star Internet Radio serves Montgomery County with news, current events, local programming, and of course, music. If you are interested in volunteering and sharing your talents in media, go to irlonestar.com and let us hear from you. Lone Star Internet Radio, serving Montgomery County from the heart of downtown Conroe.